Namaste. I welcome you all to this 24th session of Gurubodha. We have with us Dr. M.B. Guraja sir. I cordially welcome Guraja sir to this class. Coming right to the topic, again the coronavirus fourth or fifth wave is coming back up, and from what I heard, the countries like the Netherlands have completely shut down. They are fearing that in those countries the elderly population is more and obese population is also more, so who are more vulnerable, and the complications can develop more in them. So fearing that, there is this lockdowns and business complete lockdowns and shutdowns and whatnot. Again, India is somewhat blessed so far. Touch wood, I should say, that it's not affecting us in a great extent. We had like two big waves, but so far the third wave is not to be seen. And it is always a raging debate, like what are the herbs to consider, and how to go about it for preventing it, maybe, or to boost the immunity. So which has been working so very well. And Gurata sir, you mentioned licorice, bhumi amlaki, guruchi, shefali, and all. These are the herbs that you enlisted for, major to boost our immunity and to have a preventive, strategy against coronavirus. Can you please walk us through these herbs and medicines that you mentioned?
So definitely. So coronavirus, of course, in the first and second wave, it has done a lot of damage all over the world. And now there is a fear of third wave, and it is going on. And as per the yesterday's one clipping, it is from the IIT Kanpur, their mathematical calculation that even India is going to see the third wave in the month of February 2022. So there is a possibility of it maybe increased even up to 1 to 1.5 lakh cases per day. But these are all statistical point of view. As any virus present in the atmosphere goes on mutating and changing itself, and ultimately it also survives with the host. And even though if we are afflicted with this, I don't think so there will be any serious illness, and death rate would be high in the next waves. So what it may be, touch wood, the things will be in a rosy picture, not a dangerous one. Anyhow, these are the herbs which we are using it in various other viral infections and things. And these herbs have shown very convincing and promising results in various viral related issues or diseases like Yastimadhu. It's one of the versatile drug. It's not only a immune booster, but it also works in many ways. Its effect is seen on multiple systems of the body. It is very good to eyes, very good to skin, very good to hair, and good to stomach. And it is very good for the respiratory system, and it is good for the swara, like that. The one drug, it's wonderful in its nature, and that's why we find Yastimadhu in many groups in Charaka's classification. So its a reason is it's a multifaceted drug, and it is capability of acting in a multi way, and that's the reason we cannot simply keep it under one heading that it is immune booster or it is antiviral. It may be working in many ways. We don't know exactly, but the thing is, once we are using these drugs in these conditions, we are finding results, and people are feeling comfortable with that. So that is the reason we go with these type of herbs. That is, the first one is Yastimadhu. Similarly, next we have another one is Bhumi Amlaki. This is also a very important drug, and it has been proven as an antiviral, and of course it has been used in many preparations, even in Ayurveda and many of the proprietary products. And of course, this is also once again a very important drug, and people have used this even in the second wave and third wave. I mean, second wave and first wave type of times. That efficacy of Bhumi Amlaki has been tested in most of the asymptomatic and mild symptomatic conditions. In those things where people have used it. And then similarly the guduchi, one of the versatile drug. If you observe that most of these drugs It may be Guduchi, Bhumiyamlaki, and all these things, Katuki or Kalamega, Tulasi. Most of these drugs are very, very versatile in nature, and most of them may be even supportive in the name of Vichitra Pratyarabdata. And of course, their combinations are also useful many ways. And of course, it is not simply one way of whether we cannot claim that it is going to kill this one, it is going to block that virus. It may be multiplicity. That maybe it is working or acting in a very, very multiple faceted actions and multiple ways. It may be blocking the spike proteins, or it may be what you call avoiding the replication of the virus, or it may be not be giving a sufficient host thing, or it may be supporting the host defense mechanism and to improve the efficacy of fight against these viruses. So there are so many activities taking place. From the point of view of Ayurveda, definitely we in Ayurveda system of practice doesn't give much scope to the causative organisms like this virus and all those things. We always stress upon how to improve the strength and stamina and immunity of the host, and that is very, very important. So these drugs, Yastimadhu, Bhumiyamlaki, Guduchi, Kalamega, Katuki, all these things are definitely going to improve the host defense mechanism and immunity. So they are maybe supporting in a way, in a big way, the acquired immunity against these type of things. Have been in a very large way. We have been used it, and many waves of first and second, and of course across India we have used in different formulations, and we will find a lot of information and results. But there are some lacunas also, like we have been not given a chance to treat these COVID positive patients in a big way with certification that only these drugs are used or something like that. So all these mean are lacunas. Hope the things will get better sooner. And of course, vaccination is also going on at our disposal. When we don't want to go for a vaccination, or we're not taken a vaccination, but still there is a feeling of fear that we may get afflicted with the third wave time or something like that. In order to improve our host defense mechanism or immunity, all these drugs are at our disposal. Bhumi Amlaki, Yastimadhu, Guduchi, all these things available as a single drug or combinations, we can go for it.
As we go through this, most of these also act on liver, like Kalamega, this Kutki, and this Guruchi, Bhumi Amlaki. Even Mahasudasan Churna contains Kutki as main ingredient. And they all have kind of potent antiviral this one. And to think in Ayurveda perspective, Yakrutam Plihar related with Rasa and Rakta, the Dhatu, maintaining good quality of rasa and also Joragna action. And of course, Talisada Chuna and Sitopalari are, mainly largely targeting the respiratory thing. So can you please explain about Shefali? Like, why did you pick Shefali, sir?
This is one of the important drug, but it is not known to many of them. Shefali is nothing but Parijatha. During the second wave time, many people have used the water, boiled water, or the decoction of Parijatha leaves or Shefali leaves, and found beneficial Nyctanthus arboretristis botanically. And this Parijatha plant and these leaves, typically it has a lot of aroma, and it has got volatile property, and definitely it is plays a very important role in killing the virus. And people here in Shimoga, one fellow has even promoted this Shefali leaves in such a way that simply has promoted Shefali in such a way that even the people, department of police department people have also taken in a large numbers. They have consumed the decoction of this, and they found beneficial. So Shefali as a Pratyaksha Pramana, this is good, and hence I have suggested that this is a very wonderful drug. It can be used and it can be even explored in a better way. Of course, and this is a very important one. It avoids even the body ache and even the in Vataja related pains. If it is there, then also the Shefali works wonder. Particularly in case of Gridrasi or something like that, then also we use Shefali Patrakwatha, and even in the Jwara, and it is against the viruses. So that's the reason I suggested this. This is one of the wonderful drug which can be taken care of.
And no wonder it is told as one of the, its flowers are specifically told as one of the flowers which are like very near and dear to Lord Shiva. That's why these flowers, when they are they fall on the road, usually, especially Hindus who Hindu pedestrians, we avoid like stepping over it because we consider it as sacred. And why do you think that India is, I mean, thankfully, at least thus far, not celebrating very early, but still India by far is largely kind of protected, or at least it's not as affected by compared to many other countries. What could be a few reasons if you can enlist, sir?
See, first of all, I am very skeptical in this. Unnecessarily, I don't want to fall into the trap in these things. So, simply if COVID is present in any person, branding as a diseased person is a wrong way of doing things. Anybody may be having many number of such type of infections, but he may not be spreading or he may not be having any disease. His host mechanism, defense mechanism is sufficient to tackle those infections with that person. The intention of doing all these things is just to avoid the spreading of things to the people and the society at large. So that's the reason they try to contain them and infected persons and even the societies and everything, they try to do it. But simply is if there is an infection, it doesn't mean that there is a disease. A disease is entirely different, and in case of a disease, there will be a lot of intervention, medication, and administration of drugs, as well as even the services from the health sector. Everything is rated, but just for an infection, then nothing is required. Just simply avoiding the contact with the people and staying aloof and taking a little bit care of himself is sufficient. And in India, probably we are exposed to these type of things comparatively more. See, there is a one phenomena that if you don't expose yourself to these type of infections, your body doesn't know how to kill them in future if it is happens to you. So when we have already exposed to these type of things, and to a large extent, our system and your body is like that, that we will get very easily, we develop some host defense mechanism against that or antibodies against that. Whereas the West, which is comparatively neater and cleaner and they are comparatively pollution free, or their health index is comparatively high, and their hygiene quotient is also very high, and these type of things, when they get afflicted, they'll be in a sudden trap. And most of the time, these people will have because of their sedentary habits or maybe are affluent families and the society, their obesity is one of the rampant issue there, and diabetes is also one of important association. So in those conditions, that's the reason we have got a lot. We could see there is a lot of deaths in the US compared to whether other Indian countries like India or something like that, third world countries or second world countries or something like that. So it's a very typical way of handling. Accepting the things. The other way is that we have been exposed to these things for a long while, and most of them already had vaccination. That is also another reason. And already I think 60% have even completed the double vaccination. So all these things are very good thing. That's the reason we find it somewhat good and better place now. But there is a tendency, even the second wave also it happens same. First, second waves started in European and American continent. Then at the last we were hit. So here also now the second, third wave is also there, and the fourth wave is started in European continent and Netherlands and England, and every day it's England it is more than 10,000, 12,000, then 90,000 it reached. So such type of things may have happen even in India. So we should be very cautious and we should be very alert regarding this. Let's see what happens. What's packed for us in the 22 in the month of January and February. Let us see as per the prediction, whether it goes in the direction or whether it becomes a false alarm. Let us see what happens.
Thank you, sir. And an interesting point that you made, even for the children also, it is told that if they play in the mud, and we should encourage them to play in the outdoors, let them play in the mud, let them have like a bleeding chin, a wound here and there is kind of that's how they develop the develop the immunity rather than like keeping them in a totally clean environment. There's also this joke that in a city in India, the water tank, main water tanks from which the water is supplied, that was not clean for many months, and suddenly it was cleaned because people started drinking clean water. Due to clean water, they started getting illnesses and all. So we Indians are kind of accommodative and kind of friendly. Like if there's a cockroach or if there's a lizard, we're kind of okay in our house, but a Westerner would lose their mind seeing a cockroach in the house.
So that's a way of their living and their upbringing and the way of things happening and the atmosphere they live. Definitely, that gives a weightage to them. And of course, when we are exposed to these type of infections, definitely we know how to tackle them, and our body is also well coped with that. And I feel interested that many times we need to expose ourselves to these type of things. That's the reason. Once we are exposed to these things by regular activities and all those things, definitely the things will change in future. And that's the reason we should always taste what is tikta. Then only we can appreciate what is madura. So that is a very simple reason. We should know that what is a bad and how it tastes, how the things are worst. When we know that how to accept the worst and how to handle it, then at situations and a time we can handle it in a very well manner.
Even in the plants ecosystem also, like those plants which are like which struggle to survive, like grape vines are made a little cut in their stems, and they are kind of stressed. So these stress plants with restricted amount of water supply and all, they tend to give out more nutritious and delicious fruits with more antioxidants. I have read somewhere. And in the list of your recommended things, one missing point which was raised is like Vasa or Adathoda Vasica is not there, Malabar nut. Can you please explain why you have excluded that, sir?
See, one of the important effect of this corona or COVID virus is on blood clotting. So it has got a lot of afflicted part, like lungs are affected and even circulation is affected and all those things. And we have seen many patients after COVID vaccination sometimes, or even after treatment, or even literally getting afflicted with that. Once they are free from the infection also, suddenly they got collapsed and they developed some ischemia, some ulcerations or gangrenous type things and these things. All these things have been reported. So very clearly, the effect of particularly the coronavirus is also seen on blood clot and blood circulation and system. So keeping in this mind, Vasa is one of the drug which is very potent on the action of Raktapittahara. So very clearly, Vasa helps in agglutination of platelets, or even it is very good for clotting. And the reason whenever there is a bleeding, we try to use Vasa Patra Swarasa and also Durva Patra Swarasa. So these type of drugs which tend to help in clotting also disturbs the circulation or hampers the circulation, which is already hampered, it supports that. So in a clinician, it is our choice, it should be, we try to select the drugs which won't disturb or damage further. So being keeping these things in mind, this Vasa is one of the important Raktapitta Haradravya, and it helps in clotting of the blood. Better we should avoid it, because there are people with COVID, they end up with some sudden myocardial infarction, and people have lost their limbs because of clotting, and they're amputated, and even all these issues were there. So it is better to avoid Vasa in this condition. Even though Vasa is on a wonder drug, but still it has a special potency and an activity which may come in the way of our clinical treatment, particularly with this COVID season and COVID infections. So it is better when those patients, for a time being, it is better to avoid Vasa.
Are you open to recommending, say, Vasavaleha, which contains pipali, which could negate that Raktapittahara action, our vasoconstriction action, or do you want to avoid all Vasa medicines? Sir?
See, generally now when COVID things are there, people are trying to go with the single herbs. Very rarely that mass version and such type of combinations have been gone taken care of. So when we have better drugs in our disposal, why we want to stick on to Vasa? If something is there, better to avoid it because it is spectacle. I mean, it is open for discussion and it is open for even studies because this area is still a gray area. But conceptually, this is typically a Raktapitta Haradravya. Better to avoid this is a good keeping in mind, and it's a good thing. Whether people will counteract the effect of Vasa, that is another once again a point of debate, and it should be observed in a thing. And when two drugs are given and it is going, one is hampering, the other one is avoiding that. When these two drugs unnecessarily combating against one another instead of giving a good result to the body, I don't know. I don't think so. Why we should go and stick on to those type of drugs? We have got still better drugs like those which are penetrative and clearing the kapha and clearing the shrotases, like maricha is there, pipali is there, shunti is there, and even Yastimadhu, guduchi, kalamega, tulsi. There are plenty of drugs are there. We can use those drugs which can even come over kapha as well as it is a very good one. Avoiding even it breaks open the clot formation if it has happens. So that's the reason I usually avoid Vasa in patients with COVID or suspected COVID cases and in infections, and those who have a tendency of myocardial infarction of previous history, and those who have a family history of myocardial infarction, and those who have a tendency of venous insufficiency and already they have got some static dermatitis, or somewhere I could find there is a deficiency in the status of circulation, or blood circulation is hampered because of various reasons. In those type of persons, I usually avoid giving Vasa because of these reasons.
Thank you, sir. And there is a question like Yastimadhu cannot be taken with the people with high blood pressure, any other similar herb. I mean, I get this question a lot, and I keep on replying back that Yastimadhu in normal dose do not cause like hypertension. Most of it is kind of it is run as a propaganda. Like this is NHS UK NHS like National Health website. So it says eating more than 57 grams of black licorice a day for at least 2 weeks can lead to potential serious health problems such as increase in blood pressure. So and I had a very long back came across another one. So most of this is related with like glycyrrhizin, and in my previous calculation it was like 30 grams a day for like 2 or 3 weeks or something like that. So we are not recommending that. If you go to anything with the licorice, it says yes, consumption of licorice leads to a dangerously high blood pressure and dangerously low potassium levels. Licorice contains glycyrrhizinic acid, which has of well understood chains of biochemical events which can lead to a high blood pressure. Of course, we need to be careful while using it, but we need not panic using safer Ayurvedic herbs. So,
See, there is a typical way of Ayurvedic formulations. Yastimadhu of Ayurveda is not simply licorice or glyceric acid of what they are taken for the studies. In most of those studies, they have taken either licorice in the form of glyceric acid or something like that. It is not the whole drug of Yastimadhu. Here we use Yastimadhu whole drug as a churna, or we use it as a kshirapaka, or we use it as a ghanavati. So in this fashion, if our drugs are given, and of course our therapeutic dose won't go much higher, 30 grams or 57 grams per day, it won't reach to that level. Nobody can take it because very clearly Yastimadhu, if it is taken more than 2 grams, it causes vomiting. How can you go for 30 grams or 57 grams per day? It is not possible, and such type of dosage is not at all recommended in Ayurveda. So nothing to worry, and we don't in my practice of 21 years, I have 23 years, I have not seen any patient after taking Yastimadhu having any complaint or having any troubles, and maybe even the increased blood pressure or something like that. I have not come across.
Yes, sir. And and we covered like how what should be the survival strategy for patients with in this COVID era, like never ending 2+ years. Survival of patients were covered. Like what about the survival of like Ayurvedic doctors, sir? And like I mean, the business is shared for a long period of time in the Western. Many Ayurveda practitioners are there in this group. Most of them have switched to like online consultations. uh, I think like going forward for Ayurvedic practitioners, improving their skills, being more communicative, getting savvy with the internet, social media marketing, all those things become increasingly important. Not just having a clinical set of skills is going to be very useful, sir.
But what I have observed in the last 2 years, even though there was a lot of COVID issues, lockdowns, and all those things, clinics were all asked to close down. Initially, they suggested that any patient comes to you with cold, cough, ely and sari, or like that type of things, you need to report to government setup, and you need to direct them there, and so many such restrictions were there. But thank to one part, and that media, they are hype too much the things in the TV channels and all those things, and which resulted in that patients have become alerted, and the general public has become alerted, and they themselves started using many alternative modalities like Ayurvedic drugs and their combinations, and they started to think about the immunity, and all those concepts were brought into limelight. And definitely with these things, most of the Ayurvedic preparations came into existence, and it has been extensively used. And as per one of the report, that during the COVID time, many companies Chavanaprasha sale has increased by 100%, 50%, like that. And even the Brahmarasayana, and even Bhargava Prokta Rasayana, and even Yastimadhu, Guduchi, Ashwagandha, every drug has been sold in a multiple folds when compared to the normal days. So definitely the scope has been increased by the onset of this COVID and all those things, and definitely it has improved a lot of thought process in even Ayurvedic doctors as well as a common public. They come to know that there are drugs, there are modalities, there are treatments even in the Ayurveda, and people have taken it. Large number of population have consumed Ayurvedic drugs during this period, and definitely they have been exposed to Ayurveda for the first time, maybe for some people, but they relished it and they come to know about this thing, and definitely which has resulted in improving the area, or the client base has been increased. Of course, along with that, it is our duty, being an Ayurvedic doctor, a physician, that we need to cater the service to the needy population, and we need to highlight the importance of Ayurveda and the basic concepts, and how to improve the immunity, and all these factors if you brought in, definitely these things will help to improve the client base as well as the acceptance of Ayurveda among the masses.
Yes, sir. And especially in the initial months when the COVID broke out, there were like, Ayurvedic people cannot write a single line about COVID. There were a lot of restrictions. It was kind of and the community as a whole was feeling choked. And when things are like very out of control, and though the government may be making certain rules, like it's told, the public pressure and what is good for the public, kind of that comes up naturally, and that gets accepted, and then government or the restrictions will be loosened. In US, I've seen similarly with the marijuana. The marijuana was banned, and people, even teenagers having marijuana, storing marijuana in their places, in their homes, they were also getting arrested and all. But its health benefits started, appearing, especially the post-military service people started using a lot of marijuana, and its benefits started coming to the surface quite naturally among the public masses. So not through the medical or pharmaceutical route, just due to the use of public as a whole, the benefits coming out very naturally. So that was the main power empowering the legalization of marijuana. So I hope that thankfully people who were not knowing even the A of Ayurveda now know about Chyawanprash and Guruji and Giloy and whatnot. So probably this trend will continue, and hopefully more and more people will start seeking Ayurvedic treatments in future. So.
Definitely, that will improve the seekers of health seekers will be moving towards Ayurveda. That's the big way they are doing it, and of course, already people have started doing in such a trend has been already set in, and of course, it will going to further improve. That is the reason Government of India is also coming with its new national policy. They're including this Ayurveda and all those things. It's a syllabus part and from the very beginning, base levels, so that the acceptance starts from the beginning, and they'll come exposed to these concepts and the drugs and the modalities and the treatment and basic principles from the very early age. Then that will be a very important chain as a link for the upliftment of Ayurveda and the legacy of Ayurveda, which has been downtrodden all these days. Now it will be definitely improved over the years.
Yeah, and Deepti writes, US hospitals are now full again. At a webinar organized by Health Department, country medical officers reported 95% non-vaccinated people getting afflicted. Regarding the herbs that you explained for COVID, what is the best way to take these herbs? Like kashaya would be good, or chuna. What is the best way to take it, sir?
Best way is churna form, but it is a bit difficult to consume. Then go for, if it is possible, if you get these drugs ghanavatis, then it will be easy to consume. And the last option will be kashaya.
I mean, my personal favorite has become this Sudarshan Ghanuvati. Kind of easy to take, contains kutki, takes care of fever and overall kind of immunity boosting, safer for longer period of time and whatnot. So there's a case study which is come in the chat. Young male with frequent urination with Vata Pitta Prakriti, no diabetes or prostate issues. Frequent urination can be caused due to a variety of reasons, starting from stress, anxiety, to excessive water drinking habits, fluid intake habits, to even urine infection. So, in which and all ways can we think about this case, sir?
See, first thing is we need to assess what is the intake of liquids. If intake of liquids is sufficient and it is okay, then accordingly the things will be as excreted. Second thing, the season. If it is a too cold season, definitely there will be increased frequency of urination. If there is no issues with infection, irritability, then definitely it's fine. Then you can rule out those in there is no infection. If there is an infection, then there will be fever and there will be repeated irritation or itching or something like that, or even burning sensation. So if it is not there, fine, nothing to worry. Then we need to check out whether sugar is an option. There is a possibility. Urine sugar, a diabetes angle has to be checked in. Then comes the stress factor. Then comes neurological bladder, because of irritability from the nerves, because of the stress and all the reasons. There may be neurogenic bladder or neurological bladder, we call it as. So in that also there will be excess urination. So all these things. Then there is a very rare manifestations of some benign growth or maybe cancerous growth in the pituitary, which is causing the antidiuretic hormone to hamper, and that may result in the manifestation of frequent urination or increased urine. All these things we need to assess, and everything as Samsha Kalpana, we need to go for many things.
Yes, sir. And if the patient is taking any medication which is causing diuretic action, also comes into picture. Without knowing the underlying cause and going deep into these investigations, it becomes a little difficult to guess the remedies and all.
There is no problem in giving the remedies, but point is whether it will be directed pinpoint to the condition or not. That is important. Writing something, giving a prescription doesn't make any sense until unless it gives a result. If it doesn't give a result, then what is the use? You would have finished writing and you have prescribed the drug to the patient. But ultimately, your intention should be that it should generate a result in favor of you. Then only it will give a credit to you as well as to the Ayurveda. Otherwise, it becomes a counterproductive. The person will start, there is nothing in that, and I have used, it's not of use. They once again go against the Ayurveda. It should not be. That's the reason we need to be very, very clear in prescribing. We need to go for each and every aspect of Amsamita Kalpana, of whatever the possible causative factors, what may be the samprapti, what may be the reason for the manifestation of particular lakshanas. Once you finalize it, then comes the suspicion, then comes the differential diagnosis, DD, Sapeksha Nidhana, then you finalize it, probably this is the one, provisional diagnosis, then accordingly make a line of treatment, and from that line of treatment you start doing that treatment. Then if you find initial steps as intended, the results are appearing, then it's a fine, go ahead in the same direction. That is the way we need to handle these any cases. Otherwise, may not be possible simply just giving a medication and the patient has consumed for this and there is no results, and he starts telling against your prescription and even to the Ayurveda. So that is instead of supporting, it becomes a counterproductive. So you should be very cautious in that.
If assuming it is from neurological bladder disorder, what could be the strategy, sir?
No, then if it is a neurological one, then counseling also becomes a little bit part of it. Definitely there will be some stress will be there. We need to avoid those stress factors. Then we need to tone up the bladder by giving some exercises, like squatting exercises and all those things if possible. Depending upon the age of the person, we can suggest all those things. Then restricting the consumption of liquid depending upon the type of work you do and depending upon the area of his work and seasons and everything. So if you could total control over all these aspects, now then along with that you give some vatahara preparations like Samirapannaga rasa, or even Vata Vidhumsana rasa or Rasaraja rasa. Such type of drugs will definitely help to somehow to suppress the stimulation of nerves. But of course, that is a big question mark whether in the US and European countries these drugs are allowed, or there is a restriction on the usage of these things. That part should be taken care of.
Is Chandra Prabhavati useful, sir? Because it's all about that.
Chandra Prabhavati is some of the basic drug, and usually where there is a problem related with the infection or UTI, irritability, or prameha related aspects and such type of things, then Chandra Prabhavati has its role. But in a neurological condition, Chandra Prabha has a limited role.
Yes, sir. Thank you. And moving on to the next topic, strategies to avoid menopausal weight gain. Postmenopausal or perimenopausal symptoms keep on coming up, and probably it is one of the main area of focus for Western practitioners. So during menopause, weight gain happens. How can one balance it with natural processes? So that is one question, and how to maintain bone health. So let's consider only on the obesity and bone health. Do you have any guidelines, please, sir?
Very clearly, until unless we don't restrict the intake of energy of food, we are not going to curtail the body weight. And it has been observed that only a supportive mechanism will initiate a trigger off after the menopause. But basic supportive thing is the way they are consuming the food. The way they are consuming the food, in the same manner they are not spending it. So spending should be equivalent the way the amount of energy they are consuming it. So if that part is taken care of, automatically they do not go into gain the weight. And the gaining of a weight post-menopausal is basically due to errant way of eating, and of course it is supported by the system because there is a craving, there is irritability, or there is a pressure, and even she's also feeling that I am getting old and menopause and all these things, and hormonal changes, and a lot of issues will be there, hot flushes. To overcome that, she may start eating more. So many factors are there. If whatever the amount you eat it, accordingly you expend it by your physical activity or burn it out. If you could able to burn it out that content, then automatically the weight gain part will be taken care of. Many a times I asked some of my patients, many a times they say that we are controlling on all these things, but still we are putting on the weight. Then I ask them, see, I am not purchasing the sand, I am not purchasing the cement, I am not purchasing iron, I am not purchasing the brick, but still able to construct a house and many, many floors. So how could it be possible? There should be some material which is suitable for construction. So if your body is gaining weight means there is some basic material which is required for the gain of weight. It is something which you are giving from the food. First thing is curtailing on the part of taking food. That portion, if it is not controlled, then the weight gain management is whatever the medicine you give, it won't work out.
My strategy has been like, especially if the client is coming by 40 years, still there are like 4 5 years for menopause. I try to make them ready for it, and ask them then to cut down on chats or junk foods, making them to undergo oil massage at least once a week, so that the joints and all are taken care, even the stress, exercise and diet, and if the need be ashwagandha or brahmi to keep the stress level, and to have an emotional balance, and gugulu and triphala and such herbs, in a way to kind of make them bringing into a disciplined lifestyle, which they may not be following in their 20s and 30s. Is that a good strategy, sir?
No, definitely that is a good strategy. There is no harm in not doing all those things. But the thing is that why they develop stress? Very simple thing. Their body and mind is not ready to accept the things which is happening naturally. If you are getting older and older, accept it gracefully. Everybody has to get old and everybody has to have the tissue damage, everything. Our intention is only to keep on our energy even at the damaged tissues or weakened tissues even that time. So that is the only thing. And to overcome that, what we can do is that all oil massaging and doing dhyana, pranayama, reducing the stress, walking regularly, trying to maintain the body weight, according to Anjali Pramana and Anguli Pramana, what and all been given a lot of things. And nowadays, maintaining the body weight is not a big thing. There are plenty of protocols being laid down. We need to just to control on the intake part. That's the only area where we are very, people say that how can I cut down, and if I cut down I'll feel hungry and feel headache and I feel so many things, I feel giddy, and that's why I eat it. Then when you eat it, you walk it out and reduce it. The energy has to go out. When you take an energy, that energy has to be utilized. Otherwise, definitely it will going to stay in your body permanently. So that is the basic area where you need to cut on. And the next part of the bone maintenance, bone health maintenance, I preferably go with 2 cups of milk per day. That will be sufficient enough to give the calcium requirement and even the binding agent requirement. And exposing ourselves to sun for the purpose of vitamin D and all those things, and regularly applying oil, abhyanga and all those things definitely will help to maintain the bone health to larger extent.
And also Ayurvedic supplements with calcium like Pravalosma and Shankabasma, Lakshadi Gugulu would be helpful.
See, all those are definitely helpful, but until unless the Agni to dissolve those things and absorb them is not there inside, whatever you give the as a supplement, it will be waste. First, we need to improve the Agni. How to improve the Agni of particularly the Asti? If you want to improve the Agni of the Asti, then we need to give Tiktaka Gritas. Tiktaka Gritas in small quantities will increase the Agni of the particularly with Asti and Majjagata Srotasas. So when such type of drugs have been consumed, Tiktaka Grita and such type of things in the small doses, definitely they will be. And then applying oil, walking, doing some exercises, definitely that will keep on improve the Agni of the Srotasas of particularly with Asti and Majja. Then accordingly, if you give some supplement like Pravada, Shankha, Varatika, Kapardika, and these type of things in the form of basma, or then give it in the form of oil massage to improve the condition and tonicity of the muscles, definitely it is going to help. So it is better If you combine all these things in a protocol, then only it will be good. And of course, I suggest only two glasses of milk per day. That is sufficient enough to give the required quantity of calcium to the person in an adult. And of course, if there is any person who is having some taboo or problem with good, what to do, then there is a problem issue. Then we can go for some other alternatives like pravala basma, mukta basma, something like that.
You're very right in saying that, without the Agni, especially Astidhatu Agni being lit or being optimal, any amount of calcium supplement would not be good. Probably the modern medicine system is also waking up to that. That we have seen previously there was just calcium supplement like oral calcium, so and so mg. Now also they are trying to mix it with like calcitrine and vitamin D supplement and all those things. So because just when the Agni is not there, any medicine given to improve bone, especially the calcium supplement alone, might not work.
Definitely, instead of working, it causes a damage. See, our intention in those patients, the intention of giving that outside elemental calcium or chemical calcium and such type of things, their intention is to give calcium. But I'm thinking that that calcium will go and settle in the places where it is decayed or where there is osteoporosis or osteomalacia, something like that. So where there is astic shaya, so those places only it will go and settle. But unfortunately, we have seen that people are using without knowing how to use it and how much to use it as doctor prescribed, and they are continuously using it for many years. And ultimately, they have found that this calcium is going to settle in the coronary arteries, causing a blockage. So then, instead of doing something good, it is doing bad. So we need to be very cautious in that. Even the supplement also, how much supplement has to be taken, this particular type of this supplement. That's why swasthahita ahara, whatever it has been said in Ayurveda, and one which is advised to take regularly, like Nitya Rasayana, what is said by Shishruta, that is Dugdha and Grita. These two are very important. If these things are consumed properly, accordingly, then the things will be right in a right way. Otherwise, simply giving some supplementation from the outside may not solve our problem, and it may even go in a worse direction and may settle somewhere else and cause another problem.
How beautifully they said Nitya Kshira Gratabhyaso Rasayananam. It's so wonderful. And ghee is also again related with the vitamin D absorption, keeps the skin health well, which again leads to good vitamin D absorption and all. So coming to the stress and anxiety issue, there is a query here suggests medicines for anxiety related to palpitation, and also clubbing that with the menopause. What can be the general strategy, therapies, and herbs and medicines?
See, in order to overcome such type of anxiety, I would suggest them to go with Brahmi Taila Shirodhara. That is one of the important thing what they could do it. But only thing is that when outside atmosphere is cloudy, rainy season, or even excessive of winter and lot of snow, that times are not sufficient. I mean, not ideal for the Shirodhara. That is the one thing. Other thing is that once again we are consuming Brahmi, Shankapushpi, and such type of Medhya Rasayanas with counseling part of it. Definitely will reduce the stress in those patients. So there, the people of those age group with menopause, they tend to have a lot of issues with their even with their husbands, and even they got tensions with related with their body, and they got their own understanding, and now they are feeling there is a fear, and so many factors will come into play. That's the reason they are not gracefully accepting the old age. It is very natural that how the menarche has started. Menopause has to occur. That has to be that should be accepted. So if you are not accepting in the sense, then there is a problem.
Yes, sir. And children growing up and
Hmm.
arguing with for every small thing can be stressful, sir. After Shirodhara, to ward off any threat of like kapha increase in the head and neck region, can mild Dhumapana be a strategy after Shirodhara?
Yes, definitely. Definitely, you can go with mild Dhumapana with Haridra and Gugulu.
Yes, and milk is not good here, and it's loaded with hormones and antibiotics. I've seen like American students coming here and they drink Darushna Shira for the first time in their lives. They say that, oh, this is not like milk. Like their milk taste and umpteen number of processing, but still organic cow fed milk is available in New Jersey and such areas. So I've seen a person happy to take the name, Mr. Sandeep Agarwal, who also came to you and met. Like he goes after like cows, like wherever cow is there, he will drive certain kilometers to get it. So probably in a difficult country like US, if there is a will, there should be a way. Yeah, somebody has written Kalona organic milk is free of hormones and antibiotics. And somebody has written Strauss family creamery milk is good. Yeah, and regarding the anxiety related palpitation, we need to be careful to evaluate whether it's coming out of heart or out of mind, right, sir?
Definitely, we need to check even the blood pressure over there, and we need to understand where there is any peripheral resistance, if it is there. Then avoiding the salt and making the person to walk a little bit and all these things. And definitely, there are sort of a total protocol has to be followed. It's not by simple one herb we can change the things.
How do you rate this Manasamitra Vataka, sir? I mean, it has become kind of my favorite anti-stress, anti-depression, anxiety medicine. Contains Swarnabasma if we go with like the pricey ones like Kotakal. How do you evaluate it, sir?
But this is Manasamitra Vataka cannot be consumed daily for a long run. It cannot be, and it can be used in where there is a comparatively a severe nature of stress or a severe nature of problems like autism or something like that. Then I suggest in those areas it can be. As for just to overcome the stress, we have got a better drug like Saraswatarista. It's comparatively better. Brahmi Gruta, that is much better. We have got sufficient drugs like even Ashwagandha with Brahmi Gruta and Ashwagandha Kshirapaka, Yastimadhu Kshirapaka. These are all sufficiently gives nourishment to the brain.
And somebody has written like thyroid and adrenal issues also cause anxiety, and herbs like ashwagandha, they address both adrenal and thyroid issues as well. So kind of holistic aspect coming back again. You said in one of the narrations that millets, we need to be careful not to give excessive millets in case of high vata pitta prakriti person or in disorders with the high vata and pitta. Why there is precaution required, sir?
See, these millets have been told in Ayurveda as trinadhanyas. We know that all these dhanyas are from the grasses, trina. Then why specifically Acharya has mentioned for this trinadhanya? The indication is that trina here with specificity refers to the energy output from that. Means it is very little. Trina means very little. So Dhanya is also very small, and the output of energy from that is also very small. And it is very ruksha in nature compared to the other like red rice or something like that, or wheat or something like that. So then these type of highly fiber content ruksha dravyas and which gives a less nourishment, consuming it for a longer period, definitely the person, if it is obese and with lot of kapha kleda in him, then no issues. But for a person like vata pittaja or pitta vataja nature with a modern mediocre body and body bulk is comparatively less, in such a person, if he start consuming millet, initially there will be no issues, but as early as possible, he may develop little bit issues like first abdominal cramps, then later he develops there is a pain in the joints. Means all the joints will start showing the vata vardhana lakshanas. So in order to avoid those things, I suggest them to go with this. And still, if you want to go with that type of things with a less content and little bit of ghee has to be added in order to reduce its rukshata, and that component will not improve the increase the vata in the body. But it all That's the reason Acharyas have kept these Trinadanyas aside. They are given importance to red rice, Raktashali, and all these things, type things.
Hypermarketing and TV ads and the newspaper ads have become it makes the Ayurvedic doctor's life very difficult because every other patient will be asking about millets repeatedly.
Not only Ayurveda doctor, it's every doctor. Usually nowadays everything is kept open in the Google and these type of things. The platforms where a lot of information regarding health and all those things are available, whether it's a true or false, that is secondary, available. So they'll read all those things and they'll come out with lot of questions. That's very common even for the allopathy doctor. It may be sometimes they will answer it and sometimes they say I don't want to answer these things. You just take these prescriptions what I have given. They will send off the patient. So that is the reason we too also have a lot of such type of questions many a times. And of course, if you guide them in a proper manner, then they will be somewhat convinced. And such type of counseling is also required. Basic thing is that we need to understand what exactly the preachings of Ayurveda and what level we need to do it and whom to do it, why to do it. If we know all these things and we know the checks and balances, where to do it and where to stop it, then the things will be in a right direction.
Ayurveda has a recommendation for meat, but it is used in limit. Is there some reference or some text on how to make hunting of animals sacred? In US, in certain restricted areas, hunting is allowed. Of course, there are rules to follow. Some people would hunt their animal and bring it and eat the meat. So, is there any way to give a sattvic touch to it?
In India, we don't have such type of things. And in Ayurveda, very clearly, they are not taught to make it. This is something like that. What they nowadays everywhere that is going on, haram and halal and sacred and all those things. That is not been told. Very clearly, Ayurveda has spoken about the qualities of the meat, different type of meat and its qualities, how to use them, in which condition these meat will help. Like that, they have given an explanation.
Yeah, and it's a matter of like personal choices and also kind of survival. And wherever there is this animal versus human conflict, I always go back to Swami Vivekananda's example. So when Swami Vivekananda became very famous and came back to, after US and Europe trip, came back to India, so many people were coming for seeking donation from him or the Belur Mutt that he established. And one such organization was a tiger conservation organization. So they asked like money to conserve the tigers. He said that India being it was like 1900s. India was under British rule and a lot of poverty and such things. He said that I value human life more than animal lives, especially in these difficult times where India, of course, most part of India is suffering, and to protect and conserve human lives. So human life interest is always higher, and we being the dominant species in the society have, though it doesn't look ethically or morally correct, it is what it is, sir.
Of course, that is there, but of course, that's a loco binna ruchi. There are people across the globe with various interests, and even though our body is not, prepared in the form to consume the meat and all those things, or digest those things, but people are using it since long way and and it takes a lot of time to change. It is not so easy to change the one's food habits and patterns. That is not possibility.
Yeah, so and thank you very much there, sir. And thank you all the participants for making this more interesting. And thank you very much, Guraja, sir, for answering all our questions very patiently. We loved it.
Thank you, one and all, for participating.
See you all in the next class next Sunday. Namaste.